Hi, I'm Dr. Raj Patel at Vancouver Vision Clinic here in Vancouver, Washington, and I wanted to talk to you a little bit about the disadvantages of working as an optometrist. Optometry has lots of wonderful advantages, and sometimes there are these small instances where there are disadvantages, and so let's focus on those for a few minutes here. I think probably the number one disadvantage of optometry is that it's not always good news. Just like any other health profession, the majority of the time you help people and you help them with their eyesight and you help them with their vision, and sometimes you have to be the deliverer of bad news, and occasionally it happens that the patient comes in and they might be here for one reason, and during the course of their visit you find something else happening, and you have to deliver that news to them, and sometimes it's not happy news, and so that is always a very tough thing for any health professions, including optometry. I think another disadvantage of optometry is that, also like all other health professions, you try to do what you can to help the patient, do whatever is the best for the patient. And optometry, like all other health professions, has this interesting triad where we have the doctor, we have the patient, and then we have this other entity which is called insurance. And so sometimes what we want to do for the patient is difficult to do because of stipulations within how the patient's insurance works. And so oftentimes we might have to take a little extra time coordinating the care with their insurance companies to make sure that the patient gets all their needs addressed and that the patient's been able to maximize how their insurance works. So I think that is another disadvantage of optometry. And I think another disadvantage of optometry is that to some degree we have this wonderful ability to take care of patients' needs, their eyes and their eye health and their long-term eye health. And then we also have this great product that patients get, which is the glasses or contacts. And so I think one disadvantage is that because optometry has this kind of retail component where we have glasses and contacts, it is also tied into the economy. And so unlike other health professions where there's not that retail component, optometry does have that retail component. And so if the economy is suffering, sometimes optometry clinics can have a hard time too because of that retail aspect. So those are some of the very minimal disadvantages to optometry.